First in-person meeting of the Board of Early Education and Care since March 2020, to be precise. Welcome to everybody, and especially two transitions, back to in-person and a new commissioner. So wonderful afternoon, great to see you all. I'd like to open the meeting just with great thanks. First of all, to the commissioner herself for stepping in and hitting the ground running, as you'll see, both attending to the strategy and to the tactics and moving the ball forward. So it's been a pleasure and a privilege to work with Commissioner Kershaw, and look forward to this meeting and many more to come. I want to thank all of you for your support through the transition period, which of course is always a challenge on many fronts, but I know that the commissioner and I in particular really appreciated your role in supporting the transition. And of course, to the team at EEC who have continued to do the very hard work each and every day in support of the Commonwealth's children and families. I think today we're regrouping, reconnecting with many of the same agenda items as we've had. Obviously, COVID remains as part of the landscape. We have a largely unvaccinated majority childhood population that the dedicated and resilient workforce continues to serve each and every day. And for that, we are very grateful. And I know that the EEC team will tell us a little more about some of the COVID, the status of COVID measures in place, but all continues to go well. At the same time, you'll see as part of our agenda, we'll continue to focus on the workforce, and in particular, the C3 data that came to us has lots to tell us about that innovation, not just on its own, but in terms of the systems building and what we might learn from it as we continue to think about the workforce more generally, big picture, circling back to our conversations in late 21. You know, we want to think about pipeline, we want to think about recruitment in, but also retention and support in the role. So with that, I will turn it over to the secretary.
Great, thank you, Madam Chair. Good to see you all. Actually, see you all. Last time I think we were together was in a parking lot somewhere in Worcester on a 90-degree day next to a dumpster. So we are. This is a major upgrade. So it's great to be here. It's also great to have Joni Block candies back in front of me. I've truly missed those. I have saved some of them though, so I've been eating them just a little bit at a time, just so we can get to today. Oh, okay, that's great. It's good news. Here all week, you know. So that's no more jokes. But I did want to sort of follow up on the chair's comments about Commissioner Kershaw and how thrilled we are to have her on board. And I got to say, and I think anyone who has been observing up close or far away this transition would have to acknowledge how smooth it has been and how grateful we are for that. Transitions are always hard, but this one has really gone tremendously well. So thank you, Amy, really tremendous work so far, but you've set the bar very high, so you'll have to keep it up. I do want to also note that the Senate Ways and Means budget was just released moments ago. And among other things, which I haven't had a chance to really look at closely yet, but there is $250 million in it for the C3 program, which we'll obviously be talking about today. Not quite the $400 million that the governor had asked for, but nonetheless a really significant vote of confidence in that program, and one that hopefully will let us continue it forward and give confidence to feel those resources will be there. I will sort of at the same time note that it's not in the House budget, so it is a conference matter, so we shouldn't take anything for granted. And then finally, I have nothing specific to say, but I do note that summer is coming, and summer programming is going to be important for our community broadly and our providers and families. And hopefully we'll have some more to announce and to talk about with regard to resource allocation for the summer in order to make sure that we've got the funds in place so that programs can establish the kinds of summer experiences for students that they're so desperately in need of, not just to give them something to do, of course, but hopefully to continue their learning, and equally important to continue to address the social, emotional, and mental health challenges they all have. Taking 2 or 3 months off from that work is obviously a huge challenge and problem. And so maintaining that consistency of support and contact and learning for young children and older school-age students is just going to be critical. So I know that's a priority for everyone, and hopefully I'll have more to announce on that within the next week or so. Back to you, Madam Chair.
Great, thank you. I'll next turn it over to the commissioner.
Great. Thank you, Madam Chair. Thank you, Mr. Secretary, members of the board. I'm so thrilled to be with you here today. I have to say it was a little nerve-wracking. First board meeting, first in person, brand new building, trying to figure it all out. So some on the phone, getting used to in person, but it's wonderful to be here. And I'm so grateful for the opportunity to be here and to be back in early education and care and to work with all of you. You've been so supportive during my transition. It's been great. I had an opportunity to meet with most of you, talk about how we wanted to work together, how to use board meetings, and that was incredibly instructive, and I hope we'll be able to rise to those occasions as you've asked us. I also want to take a minute to acknowledge the staff who have been incredible. Transitions are indeed very difficult, and they haven't missed a beat in trying to make sure I could get up to speed, helping me learn all the amazing, wonderful things that the agency is doing, meet the staff. I'll talk about it a little bit later, but I've been to 4 of our 5 regional offices. So I've gotten to meet with most of our licensing staff in the field, as well as our other program quality, background record check, and other staff that work in our field offices. And the staff have been welcoming and open and just allowing me the opportunity to learn from them and their expertise. Speaking of staff recognition, I want to just mention that a delegation from EEC, mostly those who worked around a lot of the COVID protocols and projects and practices during the height of the pandemic and over the last 2 years in general, joined a delegation from the Department of Elementary and Secondary Education and also the Department of Higher Ed yesterday in Malden to meet with the governor. And it was an opportunity to reflect on some of the successes and the hard, amazing work that this team has done to support the early education and care field. So we talked about emergency childcare, some of the changes in policy, some of the financing changes, the things that this team has stepped in to go outside the door, come back in, think innovatively about how to do things different. And as a result, has kept the field afloat and ready to think about what comes next. And so I want to recognize the team. And we spent time in that conversation, not just talking about the amazing things this team did and stood up during COVID to support the field and to support parents, but also how to really leverage those lessons going forward. So we spent a lot of time thinking about, and we're spending a lot of time thinking about, what did we do differently that we want to keep? There are some things that never go back. There are some things that we've done that we can really capitalize on and move forward. And I would say the governor and the secretary were very supportive of the agency's thinking about how to leverage those changes in a really positive way. Staying with staff, I want to talk a little bit about some comings and goings at the agency. First, most of you have had a chance, but we have a new chief of staff, Chris Powers. You all have had a chance to meet him. He is sadly on COVID protocol, along with Charlie McAvoy, who we hope gets out first. Sorry, Bruins. Got some time. But Chris, sorry, McAvoy. Chris Power joins us, came along with me from the Department of Transitional Assistance and was a wonderful addition to the team, and also learning about the early education and care landscape, and really engaged in how best to support the EC staff and team as we figure out what comes next for us and dig deeper into the strategic plan, which we'll talk about in a minute. I also want to thank Catherine Premont, who is staying on in a new role as a senior advisor around strategy and project management. So really helping us figure out how to probably doing work on her phone in the audience, as expected, integrating projects across the agency's divisions. So that's really what she's going to be taking on. So Catherine, thank you for agreeing to stay. We also have a new Deputy General Counsel, Rob Orthman, who's joined us, and he joins 2 other attorneys who've started since January, which is helping us rebuild the legal team under Janice Smith's leadership. So thank you, Janice. Margie Gilberti, we have a new Associate Commissioner for Investigations, which is a new role to help organize and make sure that part of the organization is operating as efficiently and as responsibly as possible.
Commissioner, could you have them, could you raise your hands as you're saying their names so we can put...
They're not here.
They're not here. You'll tell us if they're here.
Okay, I'm sorry. Yeah. Catherine Premont, I mentioned, you know her. Janice Smith, who's our general counsel, who you may not have had a chance to meet before. So none of the other staff I mentioned are here, I don't think. But the other coming that I would like to announce is a very exciting one in our programs and policy team. So a senior associate for program innovation, Amy Checkaway, is going to be joining, or I should say, rejoining the department. Starting May 23rd. She most recently comes from APT Associates and is a leader and strategic thinker in the field of early education and care, and we're very fortunate to have her back at the agency. I worked with her in my first round at EEC, so I'm looking forward to welcoming her back and having you have a chance to meet her. With comings, we also have some goings to announce as well. Diana Phillips, who most recently was our Senior Associate Commissioner for Licensing Operations, retired after 37 years at the agency. She held a number of positions, family child care licensor, and then all the way up to overseeing licensing. Denise Carlin, who has been an assistant general counsel for 22 years, but 36 years in state service, and most recently oversaw our capital investment program, as well as helping with data and contracts. And so we already missed Denise and Diana, and I want to just recognize these extraordinary public servants for their time. We were very fortunate to have them here. I also want to mention many of you might have worked with Caitlin Molina, who was Deputy Commissioner for Child Care Operations. She has moved on to new opportunities. And also I want to recognize Jennifer Flagg, who is here, who has played a critical strategy and support role for the organization and will be leaving us for very exciting new opportunities. So we're sad to see you go, but we're excited for you in your next chapter, definitely. The secretary already mentioned, but about the budget, as you know, we're sort of in the middle of the budget process. So the governor's budget comes out. The House budget came out about 2 weeks ago, supported a lot of the investments that the governor had put in, as well as some additional investments for the department. It was a great budget. For EEC, the biggest difference was probably a big rate increase that was included in the House budget. As well as some additional investments supporting the Economic Review Commission's recommendations. And the Senate budget came out moments ago. We will have a much fuller picture for you of what 23 will look like at our next meeting. So we'll make sure to communicate that and have an opportunity to discuss what comes next there. As the chair said, COVID is very much still part of the landscape for our early education and care programs, and for the parents, I'm sure, in the audience as well. And we continue to work with the Department of Public Health, also with the Department of Elementary and Secondary Education, and thinking about summer camps to continue to understand what the best protocols are for quarantine, isolation, and testing. And we'll continue to communicate any changes as those evolve in collaboration with the other state agencies. Finally, to the June meeting, we will have an opportunity to discuss more of our summer programming, as well as a number of other grant programs. So, and that concludes my update for today.
Thank you, Commissioner. We are back to public comment in person, which is fabulous. And I will welcome Amy O'Leary from Strategies for Children. Amy, good to see you.
Great to see everyone. Joni even has candies for the guests. I am Amy O'Leary, the Executive Director at Strategies for Children, and it's wonderful to be here in person for the first time. I'm also, next month will mark 20 years at Strategies for Children for me, so I'm glad to see the army of Amy's is back in full effect. First, I want to thank our elected and appointed leaders. We are so grateful for the decisions that you have made and the support you have shown over the last 2 years. Second, I'm thinking about the incredible stories of educators, program directors, family child care providers, school-age staff, CEOs, and community leaders who have shown up for children and families every day since March 2020. We would like to welcome back Amy, Acting Commissioner Amy Kershaw. Your leadership, experience in government, passion for building systems that work for children and families will be so critical as we reimagine what could be in Massachusetts. This is not a time to slow down or stall. It's a time to continue the hard work that we've been doing together and to ensure a stable field for our young children and families. As you know, the crisis continues in early childhood. I have to share a comment that we heard this morning on the 9:30 call from Donna Dennett. Everyone needs to know how precarious it is all right now. COVID is increasing again. Communities have given up on fighting back. Parents are done and providers are exhausted. Even the thought of applying for anything new or taking even one more thing on seems so beyond many of us right now. And for some context, our 9:30 call started in March of 2020. We've had both Secretary Pizer and Board Chair Noni Lasso on, and we've been doing it 4 days a week over the last year and a half, and it really has built this community of support and information. We have folks from across the state joining, and anybody is welcome. We know that we were making slow and steady progress before the pandemic, and now we have this opportunity like none before. We know it's going to take time, but it's critical that while on this road to a more sustainable system, we continue to support the full early education and care field. Hearing the real-life, day-to-day challenges has helped inform our advocacy and must drive policy decisions and match up resources with needs. Along with some of the innovative work at EEC, the roadmap outlined in the Economic Review Commission report and the pending Common Start legislation tackle so many of the persistence challenges we have faced and puts us on the path to building the system that we need for children and families and early educators. And we know that the Commonwealth for Children's operational funds have provided all programs with flexible, consistent funds and the need to sustain our system. The department acknowledged that we are not getting at all young children and families by our subsidy system by thinking about the social vulnerability index. We know that other states right now are looking to Massachusetts to replicate their own state systems in this kind of a fashion. April 7th, Strategies for Children, along with Neighborhood Villages, hosted an event highlighting the impact of the grants. And also we heard directly from educators and directors about the grants and what support they were providing for their programs. We also know that EEC has information by legislative district, so we can understand how the impact is being felt across the state. And we have quotes from directors and educators about how critical this support has been, and we will send those to you in a follow-up email. We know that it's because of the C3 funds that programs have been able to keep their doors open. On the call, we also heard that 2 directors were asked by families who were looking at their program, how sustainable are you as an organization? And they had never received that question before from parents. So people understand the context that we are living in, and as they're making choices, they're thinking about those things. So right now, as Amy said, we're in the middle of the story. We have many vehicles to consider about how to stabilize our field. We continue to be inspired by the resilient and dedicated workforce and their commitment to providing high-quality learning experiences under incredible circumstances. It's time for, you've heard me say this before, it's time for change. And as advocates, we are here to help. We look forward to our collaboration with Acting Commissioner Kershaw and the whole team at EEC. So thank you for the opportunity to be here this afternoon.
Thank you. Wonderful to have your partnership and great to see you. With that, I think we will turn to our routine business. We have minutes from February 8th and March 8th. So I'll take a vote on each of those, and then we'll move into our items for discussion. So let me make the motion that we approve the minutes from the February 8th, 2022 meeting. Can I have a second? Thank you. And I'll just go around the room. I'm used to the Zoom. Sheila Balboni. Paul Belcito.
Yes.
Jamela Lee.
Yes.
Secretary Pizer.
Yes, but I will note that since we're in person, we can do voice votes now. So I'm just saying, I don't want to interrupt the flow here.
Oh, you're right. I no longer need to.
That's all right.
Thank you.
This is
all right.
good
Well, we
practice.
could call it universal design. I'll finish on this side. We got 2 on the phone. Maura Siegel.
Yes.
Nikki.
Yes.
Joni Block. David Cruz.
Yes.
Allison Schoenwald.
Yes.
Thank you. So moved. All right, one more call. I'll make it brief. Approval of the minutes from the March 8th, 2022 meeting. Can I have a second?
Second.
Thank you, Paul. I'll start at the end with Sheila Balboni. I will not say any more names.
Yes?
Yes.
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 Yes. Yes. Yes.
David Cruz.
Yes.
Allison Schoenwald.
I can't really hear what I'm agreeing to right now. I'm sorry.
Oh, the vote was for the March 8th, 2022 minutes, the meeting minutes that you received.
I think you're saying the minutes, and yes, I agree.
Thank you.
It's hard.
Okay, let's, so moved, March 8th minutes. Let's move on to our items. I'm now a little
Should I
worried
take
though
them?
that we may have a problem with Allison engaging. Dave, how's your content?
My contact is fine. I can hear everybody clearly.
Okay, all right. Huh.
I'll take them with me.
Yeah, that'd be great. High tech. All right, we're going to move now to our items for discussion and action. Our first item is just a chance to hear from Commissioner Kershaw and sort of the big picture. Obviously, these are very early weeks, but it was a chance to kind of bridge the leadership and bridge our meetings and just sort of refresh on where we're at on the strategic side, which is a great segue to the C3 discussion item. So thank you for revisiting some of the strategic landscape with us.
Great, thank you, Chair. Yes, this is day 2 of week 6, and it really
Counting already.
yeah, not counting right. Hour 4, minute 20. Okay, no, it's been great, and the team has been amazing, as I said, in bringing me up to speed. And what I'd like to do is just share a few observations from the last 6 weeks and conversations with our internal, external stakeholders. I'm going to talk a little bit about a framework that we've started to put together to think about really operationalizing your strategic plan, which I think is my assignment here. And then have an opportunity to hear from Jocelyn Bound, who's our Deputy Commissioner for Programs, Research, and Innovation. Yeah, well, let's start with getting the titles right. And as the chair said, really starting with a conversation around our Commonwealth Cares for Children, or C3 program, talking a little bit about the preliminary outcomes and how that relates to some of the core elements of the strategic plan and our thinking about going forward and supporting the early education and care field. And related, to talk a little bit about a market rate study, which is a federally required every 3 years survey of the market. Really focused on access for subsidized families, and the information we'll gather through that really relates to this core pillar of the strategic plan in terms of stabilization as well as family access. Just going to check in on our board members on the phone. Are you able to hear so far?
Right now is good for Allison. She's better off.
Terrific. Okay, so starting with just early days, I spent a lot of time, really focused meeting with the staff and learning about the amazing initiatives that are going on, some COVID related, some ongoing, that really feed up into the strategic plan. I spent a lot of time with stakeholders. We have amazing partners, and that network of partners has grown even more since I was here last, and includes funders, philanthropy, legislative leaders, amazing advocacy organizations, partners in the field who are helping us deliver some of our key services. As the governor said yesterday, one thing that's interesting about the education agencies is we are predominantly an influencing and funding entity. And I thought that was a really interesting frame to think about how we do our work. And a lot of what that says is how much the delivery of our vision, goals, and work relies on a whole network of our community partners to do that, as well as our shared commitments with our other stakeholder groups. So I've been to 4 of the 5 regional offices, so have really had a chance to dig in with our licensing staff, who are out there every day working with programs. We restarted our unannounced visits to programs, so they're out there on a daily basis meeting with programs, and we can share a little bit about their feedback that they're hearing from programs about the C3 program as well. But I think one of the most important things I learned, not surprising, but is that there is incredible support and alignment around the key strategic goals that you've all outlined in the strategic action plan, and the key goals around kind of the pillars on which we need to focus our work. And in addition to sort of gathering information and understanding sort of where the field is, we've also begun to think about some of the key strategies for really operationalizing and executing on your vision. I did want to say that I think the top, not surprising for any of you, since many of you were who I spoke to as well, workforce is the top issue for our field. Nobody is surprised by that. We're hearing it everywhere. talking to the programs. They have empty classrooms that they can't fill, talking to employers. They have folks who can't take positions, talking to families. They might not be able to find a spot in a location or for the age group in which they need. So we have a true workforce crisis. And I think there's broad alignment and agreement about that. We're not the only industry that's experiencing that, although it was certainly in existence pre-COVID and has been fully exacerbated by the current situation. And then we hear from our educators that, of course, they have a passion for the work that they're doing, but it makes it increasingly hard for them to stay in these positions in terms of salary stability, sustainability of the programs. So it is absolutely 100% the top issue of the day. And as I've talked about with Chair Lizzo, the good news about that is that we have many partners who agree and want to help us on that. So I think this is going to be not a EEC alone activity, but it's going to be our whole community of early education and care stakeholders who are going to come together with employers, our workforce system, higher education, to really think differently about how we can make it a meaningful career pathway for our early educators. And I'm looking forward to digging into that work with many of you, as well as many of the folks I've talked to in the field. C3 is most definitely a piece of this foundational work in terms of creating sustainable financing for our programs in a way, in the long run, that will allow them to increase wages, which is obviously a key piece of being able to retain a highly qualified workforce. So I'm going to be very pleased to have Jocelyn share some of the preliminary findings and for us to have a chance to think about how that relates to our programs stabilizing. So I want to just share a little bit of how we're organizationally thinking about structuring ourselves and our many initiatives to really execute on the strategic action plan. We had a lot of success at this at the previous agency where I worked, which was really taking a human-centered design approach to our work, which is focusing on the organizational structure as well as all the business processes to put the users at the heart of the experience. So obviously our key user groups, again, reflected in the strategic action plan, are our children, youth, and families, our programs, and our educators. And what we want to do is sort of take an end-to-end look at what the experience is of each of those key user groups and really figure out how we reorganize, whether it's our subsidy system or how we license programs or our experience in them receiving supports through our program, through our many initiatives, or scholarships or professional development, and really understand what's that user experience we want from end to end. So those are the who we're going to be organizing. Some of the what is maximizing access to programs, streamlining procedures, kind of the boring bureaucratic stuff that talks about how do you reorganize your processes so they're truly focused on the user and their experience from end to end in the system. So for educators, our job is to facilitate meaningful career opportunities and to figure out how to do that from the moment they're in contact with the program and with EEC, all the way hopefully through a career where they stay. And then how we're going to do that is through, maintaining a data-driven decision-making approach, really thinking about new and expanded technology. All of us have experienced during COVID the digital acceleration. In fact, this feels like a little bit we're stumbling over previous technology right now. But there's so much technology out there that can help change and modernize the user experience. Again, whether that's a family who's doing business with us by phone, or whether it's an educator who's able to use our professional development registry from times and locations that make the most sense for them to organize their career path and their credentials. So we will be really focusing on how to bring technology. And as always, we're going to also rely heavily on our internal experts as well as our stakeholder expertise, especially for me, coming back to the field for so long. It's you all and our staff who are going to help teach us how to get this work done. I did want to mention we have 2 advisory boards I think you're aware of. We have a workforce council and we also have an advisory board. We have scheduled those both to happen, I think, on the 26th of May. And we're going to be relying on them heavily as we kind of organize ourselves going forward and make sure we're checking in on policies, procedures, and program changes that we'll be implementing along the way. Okay. On the way to creating a structure and thinking about the broader business processes and organizing ourselves and bringing in technology, we identified two really critical, pressing, immediate operational priorities that are somewhat business process internally focused, although as always we do it with our partners. So I wanted to share sort of where we are and what are on two key priorities that the agency is sort of operationally focused on right now, and we'll have a little more details for you on this next on the next meeting. But there are two areas where we felt like there needed to be immediate access to kind of feedback up into the broader kind of restructuring. So the first is around our financial assistance for childcare. So that's our subsidy program. We are about 10,000 families below where we were pre-COVID in terms of total access to subsidies. Again, pieces of that may actually be empty classrooms or capacity issues, but we don't really know. We have what is about a 17,000 person waiting list, although we have a lot of information to look at in terms of who's really on that list, what are they waiting for, and what are their needs. So we are taking a deep dive into an end-to-end business process review of the way families access subsidies and trying to identify where we can pull down barriers, we can get subsidies into the hands of families. Again, we can focus on the capacity issues, but for every family that's calling us today or calling one of our child care resource and referral agencies seeking a subsidy and not able to get one, that's a job they're not able to take. And so from our perspective, we are an immediate focus on, the overall economic recovery in the Commonwealth and the ability to support families' economic mobility by getting a subsidy in their hand as quickly as possible. We do have funding available in the budget to be able to provide additional subsidies. So we're going to be trying to understand where there's capacity issues, where there might be procedural or bureaucratic or administrative issues that are getting in the way for families. So I'm looking forward to bringing back more information, but hopefully the outcome of this project is immediate increase in the number of families across all of our programs who have access to subsidies. And it may well also help us understand where there are specific capacity issues we may have. So infant care in Stockbridge or school-age care in Leominster, if we get subsidies into the hands of our families, that may show us exactly where some of the capacity issues are that we need to focus on. The other one is one you've probably heard about a lot, perennial challenge for the agency around our background record check process. So this is the department is required to do a number of background record checks for staff that are entering into the early education and care field. We have had consistent challenges in sort of the timeline by which, from the beginning of when a educator is identified as wanting to be hired, they go through a fairly extensive background record check, which starts with fingerprinting, and it goes through a number of checks through the system in terms of the Department of Children and Families, the Sex Offender Registry, and other safety checks. We want to make sure that anyone working in an early education and care setting can pass those background checks. That process has been fraught with some challenges. We're working in multiple IT systems right now, which also can create a delay. Some of the checks require some level of personal review in order for someone to work in the program. So we've had in the back, traditionally we've had somewhat of a backlog in that. So it's slowing down the ability for folks to be able to actually take that job. So we're doing an end-to-end review of the system to try and identify where we can reduce the number of barriers to get someone from the moment they're identified as somebody who wants to be hired until the time that they can get into the classroom. Of course, we have a lot of other challenges, as I said, in terms of salaries and sustainability of programs, but certainly we should have our administrative processes facilitating their ability to get into a program quickly. So two very focused operational needs that the agency is working on, and we expect to bring back next month some details. It won't stop us from continuing to think about the overall design in terms of that human-centered focus on our three key user groups, but there's a lot of work going into these two projects right now. All right, I'm going to pause there. A lot. see if there's any questions. Go ahead, Paul.
Thank you, Commissioner. And I appreciate the previous slide about keeping the user kind of at the center of the work here. And so I'm just curious, what is the turnaround right now on a background check if somebody wants to go into a role?
It kind of varies depending on how long it is for them to be able to get a fingerprint, how long it is for them to get the checks, whether or not there's any findings or not. So I think that's somewhat varied, but I'll make sure when we bring back more details about the review from end to end, that if we have any details on the timeline it's taking, we'll bring that back.
Yeah, just curious, just from an educational perspective, how, again, thinking about the person that wants to enter the field, what's that experience like for them to go through this? So I appreciate that. Thank you.
Yeah. We can also, part of it, so I should mention that we've been very fortunate. There's a team assisting us from the Governor's Strategic Innovation Group, a team who's come down to kind of lend a set of hands in both of these two areas. So they're digging deep, and part of what they're doing is not just documenting the process, but documenting the experience of the user. So we should have more details on that for next month. Hopefully fixing things along the way too, if we identify them.
Yes, I know in the past, I think some of the responsibility for making decisions, Commissioner, was left up to the programs, and that was taken in-house. I wonder if that's where some of the roadblock is, and if there's any, consideration to reversing that policy.
That's something we can certainly look at in terms of what the shift has been in timing.
It's possible the feds decided that, and we had no control over it. I don't know.
You might need to come to the mic.
Sure, I'm happy.
I'm going to invite our general counsel, Janice Smith, to come up and talk a little bit that she is overseeing our background record check unit right now and is also more familiar with all the rules and policies than I am.
Hi, everybody. Thank you, Commissioner. And like the Commissioner, I am also getting up to speed. The background record check unit came over to the legal department just a few weeks ago. So we're working to make that end-to-end user experience as good as we possibly can. To address your question, Sheila, the issue, what you're talking about are the residential and placement programs.
Yes.
That's only part of what the background record check unit is doing. So for those folks, part of the review is done with the programs, part of it is still done with EEC. We're also seeing the challenges for FCC programs and group and school age as well.
Right,
So-
no, I was talking about childcare programs.
No, those are all done in-house.
And they have to be.
Correct.
But they hadn't been in the past, that's my point.
Oh, that could be.
So that's why I'm wondering if that
Sure.
is part of the
Right.
problem, but obviously we have no control over it, maybe.
Well, so the question is that we can make sure to address next month too is where does the rule for us to take that in-house come from? When does that shift happen? And has it impacted the timeline by which somebody has a review and is able to get into a program? So we can certainly.
Absolutely.
Yeah.
Well, there's a follow-up, either point or question to be corrected if I get it wrong. But there's sort of two ways of thinking about the background record check process. One is how long, the end-to-end experience from when you begin to seek a clearance and when you actually receive it. But in between is the information sort of gathering that allows the department to actually run the check. And that part of it, for the vast majority of cases, is very quick, if not instantaneous. It's what leads up to it to get a complete record so that you can run the check that is a problem. And the fingerprinting is a good case study, maybe in some ways the worst case study about why it takes so long to actually get the whole thing done. So some of in terms of the sort of internal, let's say, administrative processes, much of that, I don't want to overstate it, but much of it is very efficient and very quick and highly automated. Not all of it, but a great deal of it, and not for all programs. And anyways, without getting into the weeds, right? But in some ways, the bigger challenge is how do you get people up to the point where you can actually press the button and run the check.
Yeah, that's always been a problem.
Yeah.
I think it's really important, Secretary, to just reiterate exactly your point, which is that this is not an EEC process alone. It involves so many other parts of other systems and data checks with other systems. So addressing sort of any inefficiencies or time constraints within the process is definitely an activity in collaboration and partnership at the same time that we're trying to figure out how to make sure our internal processes are as expedited and as possible.
Absolutely. Exactly.
Well, so, and if we think about the target population then maybe actually the user experience that's the most challenging precedes EEC's formal role, but EEC could certainly play a role if we think about, cultivating the pipeline and taking strong takers, then maybe the work to be done is actually precedes the check itself for the user experience.
Right. So I think to our responsibility to have a leadership role in trying to figure out.
No, that's great.
Right. So if what we want to do is help any provider who has identified someone who they want to hire, right, we should get in there, even if it's something that's not exactly in our control, and see if there's a way for us to help facilitate that process as much as possible.
Thank you. Hi. To build on that comment, I would be remiss if I didn't talk about the workforce, the preparation programs for many of the folks wanting to come into the field, who aren't yet ready to be employed, but want the professional experience. And I know our institutions of higher ed have always had a lag with that. So I hope that can be rolled into just a few other things that you're doing with the background record checks.
Right.
I know it's holding up student teachers, it's holding up child life folks. And if we want to increase the workforce, we want to get them in there and get their professional experience. So that was my last comment. Let me go back to the beginning. Thank you for all your comments. I think you summed up our conversation as well as I'm sure what you had with others. And I think the workforce is a tremendous, tremendous issue that everybody is dealing with all different ways. I'm also pleased to see that you're addressing the advisory councils and the boards, because we need to see those voices. Thank you. I totally agree with these two primary areas, the financial assistance for childcare and the background record checks. I mean, we have to get those are critical. At the same time, I hope we don't forget the other components of what the department is doing, because it's such a great deal. And I think we need to highlight it just as much as this. The other pieces of our work, the mental health work, the curriculum work, the instructional work, all those other pieces that are supporting what happens when children get into programs, or what happens with families as we're supporting families. I hope that comes up. And I think you mentioned this on the wait list when you come back, when you can squirrel through. It would be interesting to see the ages of the kids that are on the wait list. I think you mentioned this, how many infant toddlers, how many preschool, how many school age, so we can look at where our gaps are.
Absolutely. We can look at it by age groups and also by geography, which might be instructive as well.
Great, thank you.
Okay, thank you.
It's I was actually going to make a little bit of a different comment than you just made, which was how much I appreciate that you are saying, let's nail these two things. Let's do these bite-sized but meaningful things that we can accomplish and demonstrate success on. So I agree with you, Joni, about how important all the components are, and I do appreciate focus, because that will, I think, help us really see the kind of impact we're making. So that's one thing. So it's not in contradiction to you, but it's an appreciation of the focus. I just want to say out loud what you just said, because I think it's back again, 10,000 families below COVID, but pre-COVID getting subsidies, 17,000 people on the wait list, and we have money to distribute. So I'm just like, I want to just for the record, say it back. Thank you for sharing the data, and that just validates why that's such an important priority. And then the last thing, so Commissioner, on the workforce point that you said something that I just want to ask you about. From the moment, so you talked about educators and meaningful career pathways, and you said from the moment they're in contact with the program. And it just made me think, okay, and I just spent time with a superintendent in Texas who was telling me how he's trying to solve the problem in his community by actually making high school the place to motivate people to want to get into that career and creating opportunities. And so it made me
sooner
wonder about the actual marketing of and promotion of and taster of that happens in high school, and any collaboration you have in mind or envisioning with DESE to get a little earlier than the moment they call the program, because we need more than that. to get into this profession?
No, you're absolutely right. And I was thinking more of the transactional piece of the background record check, but I think our responsibility in terms of the field is to really be thinking about pipelines of educators. And I had an opportunity to talk with Commissioner Riley yesterday, and both of us are pretty committed to trying to figure out how to work together on some of these key workforce issues. And we had I'm hoping we'll have a chance to come back to talk more about workforce issues and some of the professional development work and how we weave that together around a meaningful pathway for educators. But the conversation we had with the team this week was, what do we need to do to get educators in classrooms sooner? Like, are there apprenticeship models? Are there, right, can we think differently about, we have some amazing programs in partnership with higher education, and I think, Joni, this was embedded in some of your comments, but sometimes we're not accessing those programs because, folks might not be completely comfortable accessing them, or there isn't the connective tissue between where they are now and, enrolling in a higher education institution, and what role can apprenticeship programs or the early education and care programs have in sort of helping build that skill set, maybe even while they're working in a classroom once they've had their background record check done.
The vocational programs in high schools have
Yeah.
always been
Right.
a wonderful feeder.
Yeah.
for that.
I guess, can I just ask one follow-up? Because it's so good that you're focused, and like in a month, you're gonna come back and tell us everything. And the longer term, how are you thinking about balancing your own leadership, like overseeing nailing these two, as well as then ensuring sort of the building blocks for solving the workforce?
Yeah, it's a great question. I mean, the answer is a great team. And some of the work that we're doing around thinking about the user experience is going to translate to the organization chart, right? So somebody's got to be responsible for the educator experience, and someone's going to be responsible for the family experience, and someone for the program experience. And we have a lot of that talent already, and I think we're going to be recruiting additional talent to make sure that, right, it's not me who's who's doing these projects, but working with you and working with stakeholders and helping direct the resources to make sure we're both focusing on delivering in these two specific operational areas, but working on the longer term strategy too. So it's definitely a team sport.
Sheila.
Just to build on that idea of team, that saying, that logistics eat strategy for breakfast, I keep hearing recently. And I think, building the team here and spending time as one of your focuses and goals will be important in order to achieve these important goals. So I hope, we can hear more about the systems that are being built here. I love the idea of connecting to the regional offices, and we can build on that strength that you have, Commissioner.
Thank you. Yeah, definitely. Top priority is really focused on supporting and building the team here to have the tools and resources they need to focus on this.
Just going back to the two priorities that you outlined, really glad to see those two, and I think those are great, right on. And when it comes to the financial assistance and subsidies for families, as you're looking at getting folks off the wait list, I hope that the team will also consider how families are able to keep their subsidy, because that's another piece of it that we've seen in our work a lot, is not just the confusion around first accessing a subsidy, which is hard enough and requires multiple different people trying to figure it out together, but for families to keep their subsidies over time can be really confusing as well. And there's been a lot of kind of confusion or lack of communication that families have experienced, and so they end up losing subsidies and then of course losing jobs.
But not because not because they've lost eligibility, but because they missed an administrative step in the process, right? Yes. So that I think we're really committed to trying to see where those administrative hurdles result in some kind of turnover that is disruptive to a child's education, plus somebody losing a job. This was a real focus of the work at Department of Transitional Assistance, where I was previously, which was that kind of turnover creates not just a disruption for that child in their education and for the families in their work life, but more work for the system. So some time that could be spent enrolling another family is being spent re-enrolling someone who shouldn't have been. So I think that's a terrific point, and we'll make sure that's as much of a focus, the stability, as much as the easy on and then stay on. Yes. Right. Other questions on sort of our initial priorities and strategic framework? Great. All right, well, thank you so much for your comments, and I know the teams who are working on this, even though they're not all here, are watching on the YouTube channel, so I'm sure taking copious notes on your questions so that we can come back and address some of those next month. So pleased to be able to invite Jocelyn Bown up. You can remind them of your title. If I can remember it. If you can remember it, you can remind them of your title so we have a chance to really dig in. And as I mentioned, really pleased to have the opportunity when I came back to the agency and learned about the Commonwealth Cares for Children, or the C3 program. I was like, oh, this is the paradigm shift we've been looking for in terms of really trying to figure out how to address the gap between costs and what families can pay. And of course, it's not the full set of answers. And of course, they stood it up in 2 seconds flat. So nobody's going to expect they got it all right the first time. But it's a really promising approach to thinking about the strategies you've included and the goals you included in the strategic action plan in terms of real stable, consistent, sustainable business models in early education and care. Yep.
Well, thank you, Commissioner. It is good to be here with everybody in person. Just a reminder, it's been 2 years since I've given a presentation in person, so I'm relearning a little bit on that front too. But it really is nice to have the interaction and to be able to be back talking about the C3 program. In this presentation, I will run through some of the successes that we've seen over a year, or almost a year, of the stabilization funding we've been providing, and also review some of the information that we have been collecting as part of the grant process. And I think a couple of things just to call out as I go through the various points in the presentation to think about in framing up a discussion. This is really an opportunity for us to look back and think about what have we learned from this year's implementation that could inform ongoing thinking about the ways in which we could provide this type of foundational funding to programs going forward. And also, thank you, what other information might we want to gather? We have some more coming through a second grant survey that I will speak to, but I do think that it's important for us to continue to think about ways that we can dig into the most important points, particularly those that can inform next steps. I believe I have a clicker. Let's see if I can use it. Yes, look at that. So the next part of this presentation really is focusing in on the strategic pillar of supports for programs, in particular the types of stable financing that we might provide and the ways we can think about this type of work. Just as a quick background, the federal funds that came from CRSA and ARPA really provided us with an historic opportunity to provide this type of funding for programs. To the Commissioner's point, it is a paradigm shift and something that we were talking about even before the pandemic hit. But the federal funding was really designed to support this type of program. It was meant to go out in grants to programs. We were required to provide funding to programs that had been receiving subsidy funds, but also programs that had never received subsidy funds as well. And to ensure that the funding was directed to programs at a level that was sufficient to sustaining operations. So one thing that we did think about is we had some cost data that we could work with, and we aimed for roughly 10% of operating costs based on what we knew about program costs at the time. And then worked with third sector to develop a formula to allocate those funds according to some of the cost drivers that we knew existed in programs, while not making a formula that was incredibly complicated, trying to find a simple but effective way to allocate those funds. And we have seen a huge response from the field. At this point, we're at about 85% of all eligible providers have come in for the grant. And I will just add that at this point, new programs that open are eligible for grant funding once they have opened up. If you look at those who have been open since the beginning of the pandemic, we're at about 87% of those that are eligible coming in for the grant funding. And of those applying, 60% are serving children with subsidies, receiving a little bit greater amounts of funding at 62% of the funding. Those numbers have been shifting around over time because the other thing that has happened with this grant is programs can apply for the full year of funding at any point in time. So a program could choose to come in November and start applying for July, August, September funding as per their eligibility. And we did see some of the larger programs waited until later in the grant period to start coming in. So the body of programs in the grant has shifted to some degree over time. But we have, it's higher now. When these slides were written, we've dispersed about $320 million. There's more because another payment cycle has passed since these slides were made. At this point, we have about $95 million left of the original funds that were allocated for this program. And again, that needs to cover both some of the prior months that programs might be coming in for that they have not yet applied for, the months of May and June, and then a workforce bonus that I'll talk about in a minute. But on average, FCCs are receiving a little under $1,500 a month, and center-based providers are a little over $12,000 a month, it being larger. So a lot of that is driven by the differences in license capacity. And we've heard from providers that they're really using these funds, at least as per November, and we will get updates on this soon, to cover operational costs. And that has been a primary use of this fund, and these funds have really been essential for programs to stay open. And we've also heard this in talking recently to the licensors, that they reiterated they've been hearing that from programs that they're speaking to. Although also recognizing that programs are finding ways to continue to invest in quality and use this as an opportunity to take on some other costs as well.
Can I ask two quick questions? Do you have a sense of why there was this lag at the level of the larger centers applying later?
I think it was the administrative burden of
Yeah,
getting
that's
the
what I
information
wondered.
together. Because in many of those larger programs, they centralize the grant enrollment or the grant application process. So it is a by program.
And less of a crisis potentially than for the FCCs in COVID.
Yeah, no, they had more of a buffer.
The other question I have is, do we know anything about the 13% that haven't touched this at all?
They tend to be smaller and less likely to be using subsidies, which I don't think is surprising. I think there's
small, middle income potentially serving centers.
Yeah. And I mean, we've had ongoing debates about the types of outreach that we might engage with those. I think as a number gets smaller, it becomes a more manageable number to start wrapping our mind around and thinking about, are there direct contacts that we might engage in?
That's helpful, and I don't have a viewpoint that way. I was just curious.
Can I also ask a question about, from a provider perspective, if they have the funding for 1 month, how many months out are they certain they'll have this support?
So we have committed to providing monthly grants through the end of June. And then the budget process will determine what happens next year.
So, right, so as Jocelyn said, we have funding right now planned through the end of the fiscal year, and the good news we received today is that, at least on the Senate side, there's funding to continue the program into FY23, and we'll see what happens in the budget process.
250 in the Senate side, this 320 million or 320 plus 95. How do we?
So we'll have spent by the end of this year. It'll be approximately, probably about 400 million that we'll have spent on the program between the bonus funds, the monthly payments, and program design and implementation too. So
12-month window of this fiscal year.
Started in
The Senate bill would probably get us through the end of the calendar year, maybe into January. Hard to say.
Okay. At the levels we're doing now.
Right.
Okay.
Okay, so it's not meant to be
Based
a
on the
full-
current program.
Okay.
Yes.
So that's
Around the corner.
a little tricky, but I'm thinking that's tricky for a provider who's trying to decide about a year-long commitment and whether they can stay open and offer seats. Is that the way?
Right, I mean, well, then this has been the case, this has been the issue with these grants, is that it's a grant, it's not, and so, can people really raise payroll, with a grant?
Yeah, I mean, certainly some of the feedback has been, and we've heard it from educators too, and we heard it from licensors, I mean, this was intended to be sort of federally funded one-time stabilization funds to keep the field afloat during, and we've built something quite innovative, and so I think there's an interest both by the governor and hopefully by the legislature in continuing it, even though it may take a slightly different form. But certainly we've heard, the one-time nature, where we really, the programs need support across the board, whether it's insurance or operations or other things, but certainly their ability to put it into teacher salaries depends on the structure of the program in the long term.
But it's a window into sort of this notion of how do we bolster infrastructure to build a system, right, that functions through fluctuations, et cetera. So there's some learnings that we can talk more about in that way too, which is ideal.
Right, and the survey that's out with the providers right now, we hope will help further inform that.
Yeah, and I think the other piece too, we've been trying to track, and I'll talk about this more later, is sort of what's happening contextually for programs. Where is enrollment? What's happening with the workforce crisis? Like, what are some of the challenges that programs are also navigating, which have implications for revenue and expenses and the extent to which programs can serve their license capacity fully. And those are also shifting and changing over time. So there's sort of a balancing between thinking about what would we like the grant to be invested in, but also understanding where the future is and what they're able to invest in and what they need the funds for.
And we'd love to get those families, with 10,000 vouchers out into
Get
into
the vouchers
programs
out.
too, if they can open classrooms and serve them, right? Yeah. So this month we are putting out an additional one-time workforce bonus to providers where it's available to anybody who's come in for the grant funds until last Friday. We are in the process of looking, now that we know the full eligibility pool, at exactly what we can put out as a per slot amount, but it will be following the same formula. So it would be a per slot amount. Right now it'll be around $30 per slot. We're again finalizing that number, and then run through the formula with the staffing and the equity adjustment. And that will go out as a one-time payment for programs. There will be an application process through the same lead portal that we've used in the past for the monthly recertifications, but it is separate from the recertification process. So a program who's already recertified for May could come in and get the bonus immediately once it's made available in the middle to end of this month. And then the payments will be provided to providers in the next payment cycle as an additional payment on top of their monthly grant payment. And we expect those to begin in the June payment cycles. And these, yes.
I'm sorry, can I ask a question on that? Is there going to be any questions? Are we going to gather any data in terms of retention of the staff that get these bonuses? And because I think we can extrapolate that.
Yeah, I think, to be clear, the bonus is going to the program, and it is available for programs to use for stipends and bonuses if they choose. It is also available for other types of quality investments. So, for example, we're hearing from FCC providers that they often offer longer hours for families, and they aren't necessarily recompensated for those extra hours, or they may provide some additional services and supports because, they are so focused on those types of supports. So we're leaving some flexibility in the budget, but it is definitely available for programs to use as stipends and bonuses, and it's certainly something that we can look into and understand.
But even for those other factors, as you mentioned, I think it would be interesting in the long run to see what the data says in terms of where those funds are going, what's happening.
Mm-hmm. Yeah, and we can fold that into, as we have ongoing data collection opportunities, we can fold that into it. The other piece too, I think, is just recognizing that the grant funds are one part of a program's larger budget. So we're also just trying to track in broad terms, and this is something we will get from the survey. What are the investments at this point that programs have been made through stipends, bonuses, salary increases, changes in benefits into their educator and their workforce pool, and sort of how many educators have been affected by those changes. Sheila.
Jocelyn, have we given providers any flexibility around creating subsidies for their childcare for their own people, without having to push them through necessarily the eligibility gates?
I mean, it's certainly an option for programs if they do want to create their own in-house
Not saying they
scholarship.
can't do that.
Effective. Oh yeah, no, absolutely not. And some have, and there certainly have been a few programs that came back to us and appealed their equity adjustment, for example, and saying we do actually provide significant scholarships using other funding sources than the subsidy, and we would like the grant to reflect that, and that was something that we would take into consideration. But it's certainly available. And we do continue, I don't know if you want to speak to the OSD waiver at all, but not to put, but it is, we continue to acknowledge that it is also important for programs to have the flexibility around the relationship between their subsidy, how much we pay for subsidy and what we're charging.
I think some have created pension plans too,
for their staff. Yeah.
For
So
staff.
putting it into, the program was designed with quite a bit of flexibility to keep, programs to invest in what made sense for them. And I think that is going to be an important question going forward to make sure that we're, it's designed specifically enough to get at what we're trying to accomplish, while also recognizing that these are small businesses that operate very differently in some ways than any larger institutions. So they need flexibility in where they're going to put their funds, how they're going to retain their staff, including thinking about scholarships for their own staff who certainly need them to afford early education and care.
But is an important benefit for staff. And I think, that is another way that we can think creatively in working with programs and looking at what are the opportunities that we can sell as benefits to staff. I mean, the other way to, something that's been on my mind a lot is we're doing a lot of work, which we're not going to get into today, but will at other meetings, working with higher education and the community colleges and making coursework available. And it's certainly, I think, something that we could think about framing as a benefit as well of working in the early ed field, is that there is this type of access being supported.
Should quick check in on our members on the phone if you have any questions. It's probably hard for you to raise your hand that way. That's a good point.
Allison dropped.
Oh, okay.
For executive session.
Oh, okay. Dave, did you have any questions?
No, thank you, Commissioner. That was great explanations. Thank you so much.
And actually, the next slide is just a quick look at what we will be gathering in the April survey. So this is currently out right now. It was posted in the middle of April. So this is something that providers will do before recertifying. So you have to go through a survey. And I do want to say, I'm just thinking about Amy Larry's presentation. Thank you to everybody in the field for taking the time and providing this information. We do recognize that in a moment in time where everything is so hard to do, the information that we are asking for is an extra step for people to take, but it really is important in our ability to understand and continue to plan around this grant funding. So this is an extra step that everybody's taking as they recertify starting in mid-April. We expect that right now we're probably receiving the bulk of the surveys because many providers do come in to recertify at the beginning of the month. Upon writing the slides, we had about 2,000. I suspect that number has increased substantially at this point in time. There are a couple of points that we are continuing on from the fall survey, so we will be able to look at trends over time, understanding how programs are spending their grant funds. So, Joni, to your point, sort of looking and seeing the extent to which the funds are supporting programs and investing in staffing costs, but also looking to see, are we seeing differences in terms of what was reported in the fall and what's being reported now, or is this really continuing to be an operational support for programs for their basic operational expenditures? Diving a little more deeply in enrollment, I will speak at a high level about enrollment numbers, but looking more closely to understand part-time versus full-time enrollment as well during the survey, because that does affect the extent to which a program really feels like its capacity is full, and understanding staffing changes. So continuing to look at changes in open positions, for example, as well as new to the survey is understanding plans for salary increases, as well as the types of investment in educator compensation and benefits, which I talked about before. Additionally, we're interested in understanding, and this is new in this particular month, hearing from programs around, sort of what have they relied on this funding for, and what are some of the changes that if they did not have grant funding, they would have to make in their financing decisions. And looking at the types of supports that they do provide for families and digging in a little bit more deeply and understanding the extent to which programs are providing longer hours, comprehensive services, holding openings for pregnant parents of siblings, for example, some of those types of supports that programs provide. Looking at the barriers, the programs report to subsidy participation, which I think will fold into our ability to continue to build that access. And there's also an optional cost survey. This is really going to give us some preliminary cost information. I'll speak later, but there is a longer term and more extensive plan for gathering cost information and doing some cost modeling work, but the survey will be the first step in that process. Yep.
So, excuse me, I think it's great. We're asking for more information. We always just want more, right? What are we going to do with it? But we want more. I'm particularly interested in the supports for families in the programs. And I think the department is at a precipice with some of our grant programs to think about how we can provide support to families on an ongoing basis, not just those in programs. But I'm sure that information will inform some of the other initiatives. Mm-hmm. And I think that'll be interesting to dig into. Mm-hmm. Yeah. So I'm glad you're looking at that. Mm-hmm. Because we obviously we are providing supports for families not in programs. And let's see how
Let's
they
think about how
crosswalk.
they can connect. Yeah, that makes a lot of sense.
Okay, we're going to move to just some highlights of findings.
I could stay here all day, but I'm not going to review the.
I'm like, I think we could move to the highlight parts of what comes next.
I won't review the formula, but this is just a reminder of what it is and the ways it was designed to direct funds. We've seen this slide before. This is an ongoing tracking that we've done with third sector, just looking at the extent to which the uptake is higher in the areas that we are really most interested in supporting in BIPAC, Census Tract Gateway, high SBI, as well as those serving subsidies. We also see that programs in these areas, as well as those serving infants and toddlers, are getting more per slot with the funding. So the indications of the formula is working as designed. This is just a timeline to sort of remind us where we've come from and how we've structured the grant. And again, it includes the periodic surveys in addition to some of the key decision points. And I think at this point, we've reviewed all of this information. One thing that we have been looking at is the extent to which, sort of thinking about what's happening contextually, the extent to which the system's capacity has returned to pre-pandemic levels. And the good news is that we really do see the system does seem to be coming back. A little bit more in the center-based side than on the family childcare side, but both are robust. And overall, in terms of the number of providers, we're at about 92% of pre-COVID numbers. And if you look at licensed capacity, we're up to 97%, which I think reflects the fact that the center-based providers do serve more children.
Important to note, though, that the staffed capacity is really different. So, I mean, one of the things that I took away from this data is, okay, we have a lot to work with. Thank God they didn't close. They're here. Their doors are open. They may have classrooms that they're not able to staff, but at least this helps us understand sort of where we need to focus our resources and efforts, right? Yep.
Do you have the number on staff or no? Not yet.
So that is actually one thing that we're asking in the April survey, is to understand the extent to which capacity has been limited by staffing restrictions.
I'd just be curious if you have this information by region.
We do.
And I like slide 13 too, about like where how the data aligns with demographic information. And so similar to this, like where are there still maybe some childcare deserts out there that didn't reopen since the pandemic? So just curious.
Yeah, no, I believe the regional information is in the appendix of the slides. Okay. There is some variation, although it is pretty robust across regions. We have looked at smaller geographic levels, and there is more variability. So I would certainly say, as we think about ongoing analysis into the future, looking at that more nuanced variability is definitely something that we should be thinking about deserts,
29.
as well as... Thanks.
Let me just applaud this data culture, though, because this is the only way to make policy, right? To do the very best we can by the dollars, which is to have the information. So to get this and to be able to present it in these ways and look at it in these ways is just tremendous. So thank you.
Well, I also want to thank my team.
Absolutely.
Adrian Murphy and Wendy Way have really put a lot of time into analyzing and creating these. I can't really take credit for them myself, but thrilled to have a team.
Good leadership. Great.
Yeah, and I definitely agree. Data-driven decision-making is good and absolutely what we should be doing. And just wanting to echo the point that was brought forth in the public comment of folks feeling like they can't do one more thing right now. So how are you all thinking about balancing, and obviously this survey is out, but in the future, how did you consider sort of how much, of course we want all of the information, but how do we keep it easy for manageable, because especially for Family child care providers, I think of my child care provider was actually asking me for advice on how she should fill out the survey. I was like, I actually have no idea, but they don't have a grant specialist on their team or anything like that, and so just thinking about like how do you balance those two desires.
It is a challenge. I mean, we certainly spent a lot of time in designing the survey and thinking about what we'd actually use for, like, what are we going to do with this information once we get it, not just what is information. Interesting to know.
Yeah.
I think the other balancing point is also thinking about, sort of how do we set this up so we get quality data and we're not asking questions because we'd like the answer, but the data might not be high enough quality to use. So it's just a question that ultimately we're not gaining anything from asking. And I think we're still figuring that piece out. I mean, there's certainly things that we ask and then we look at what we get and think maybe we won't ask that again. And I mean, we try to create a structure through this where it's relatively predictable. The 2-time surveys are different and they are a little bit more extensive. The recertification process is really pretty standardized, and really all you need to do is go in and enter changes as they happen over time. So hoping that helps. But it is a balance, and it is something for us to constantly think about and just be reflective on.
I think it raises a good question about whether there's some technical assistance support or something we could have internally, especially for our family child care providers, you know. And I think we have heard from our subsidy providers, you know, we get a lot of information from them through other sources. So making sure we're, again, stood up in no time a brand new federal program, right? Yes. But I think thinking going forward about how are we collecting data otherwise through our licensing system or through our subsidy system, and is this redundant for some providers? And then thinking maybe there's a support or technical assistance that could be provided for our family child care providers or smaller center-based ones who don't have staff that do this.
Is there a difference in, I don't know how to ask this question, thinking about the independent family child care providers as opposed to providers who are part of a family child care system, and how the data is coming in for that?
That's an interesting question. I realize I don't know the actual data entry question that you're asking, like who is coming in and responding to the grant. I think it might be more similar across those two entities than it is from an independent center-based and a larger umbrella organization where there's one person.
Yeah, I'm just thinking it's family child care because we know the independent folks, you know, your children's place or where I put my daughter, you know, they're their own island, right? They don't have that administrative piece. So I'm just curious as to if we provide technical assistance.
Making sure they have access. No, that is something that we've been talking a lot about, and there's been an ongoing review of the ways in which technical assistance and, you know, other types of support are available to FCCs broadly, and thinking about how we might build that system out to ensure that things are more broadly available. Yeah. That's okay. We'll get there. So this shows, I see our little boxes didn't show up. This shows what happened over time. The blue line reflects the programs that were open prior to the pandemic, and the orange line reflects new programs that opened since the pandemic. And you can see that initial drop is the emergency closure. And then as the pandemic ended, right at the end of June actually was when programs were allowed to start opening. This line smoothed out that curve, so it looks a little odd right there. But in any case, at the end of June, programs started to reopen, and you can see the pace of reopening that happened during that time period, as well as the fact that new programs did start to open up. In some cases, there were some ownership changes going on, just to call that out. But largely, we saw that about 80% of programs reopened by September, and in most cases, those were the programs that did reopen in that initial fast reopening period. And the growth that we've seen since then has been new programs coming in and becoming newly licensed. And if we look at those 923 programs that have been newly licensed, we see that 61% are in the higher SVI communities, 69% are FCC providers, and 37% are serving children with subsidies. So I think in that place, it both calls attention to an opportunity. I think it's also important just to remember it takes a little time for a program that's newly opened to access subsidies. So there is likely a lag there as well.
Awesome. Quick question. Do you know how many of the 923 programs might have received C3 grants or applied for them?
I don't, but I can find out. Okay. Yeah. I mean, I know a lot of them are coming in because I get notifications weekly as new licensees come in. And we've been updating the grant applications and who's eligible and who has an application available to them regularly.
I guess it sort of raises potentially one of these questions, which may be, again, useful information going forward, is the extent to which these kinds of operating grants can be an incentive or an enabler of expansion of by opening new programs.
It would be interesting to see the same data for different industries
Mhm.
against early education
Yeah,
and
sure.
care, right? Like
Yeah.
they didn't stay closed long.
Or even against
Yeah.
what the historical pattern has been of new programs opening up, whether this is actually different from the pattern or just returning to the original one.
And then in due time, whether the formula should adjust for the first 6 months or something.
Yeah.
Right. Should you have a sort of startup
Capital investment.
Yeah.
or startup costs of any kind? Yeah, no, and there's been a lot of thinking lately internally around how can we support new programs as well, and like what might we do, not just financially, but also in a supportive way to build towards success. And digging into this a little bit more closely, this is starting post-pandemic and looking at percentages of different types of programs that have reopened. We saw that larger programs reopened faster and at higher rates. I'm debating in my head whether I walk you through this or just let you look at it. There are a lot of lines. Any questions? But, I think you can see the FCCs are in there in the purple line. They kind of reopened quickly, but then leveled off at a slightly lower percentage than some of the other groups. The blue and the orange line are the larger center-based providers. And in thinking about who's reopening, who the newly licensed programs are, we're seeing it's almost like a inverse in that they're largely FCCs or smaller GSA programs, although we do see programs opening up across the range. And this is looking at the percent of licensed capacity that were filled with subsidized children. So again, programs that rely more heavily on subsidy reopened more quickly and more robustly. And those without subsidized children were less likely to reopen and did so more slowly. Looking at enrollment, I think you've seen this before. This shows time points from July, November, and March. And it is just a raw percentage looking at the number of children that they have enrolled divided by their subsidy to capacity to get a general sense of how much of their capacity is filled with children enrolled. I think just the one thing to call out is that part-time, full-time distinction is not embedded in this. So when we do get the survey results, we can try to do a more nuanced adjusted capacity and look at, get a better number for the actual potential capacity being filled. But what this does show is that enrollment is trending up over time. But not consistently across program types. So FCCs really seem to, be filling themselves at around, with these numbers, 84% of their capacity and staying pretty stable. The smaller programs continue to report the largest percent of capacity enrolled, and the larger programs show less. And those trends are consistent as well across each of the time points. So I think, in terms of thinking about more nuanced analysis going forward, it does seem like one thing for us to also start understanding are the differences in terms of how different programs and different program types are recovering in different ways, as well as understanding the extent to which programs are providing families with the services that they are looking for. Because, one other thing that we heard in some of the feedback from CCR&Rs on the wait list is that some families are having trouble finding slots that meet their needs. It's the infant toddlers again, which has been a longstanding challenge, but it's also the hours that are available families in some cases, or location. We know everything about a family's work life has shifted and changed since the beginning of the pandemic, and where families need care has also changed, as well as do they still need full-time care, or is there more need for part-time care? So there's ongoing work that we can do to also understand some of those differences.
I'm doing the same thing that you just said, because I'm debating whether I should open up this can of worms, but I'm going to do it. So one of the things that's fascinating about the closing, the reopening, and the changes is that it's also, to what the governor said about the role we have as influence, is the opportunity to influence quality, the quality of the programming, the degree to which a program is effectively doing learning and development. And I'm curious, well, one is, have you thought about in the data collection process, collecting indicators of quality? And then two, just maybe more globally, I realize, actually, I don't know how we define quality. So that's the can of worms. So but I thought I'd put it out there because it's overflowing in my head.
That last piece we can put on an agenda for a future meeting. We can come back to that.
Could we? I mean, that would be great.
Yeah.
Here.
Yeah, and I think Sorry, I lost my thought. I heard an answer to the first part of the question. In terms of understanding and what we know
Yeah, like,
right
is there
now.
some data collection we could do that, in the future?
Yeah, I think it's important to recognize we put a pause on the QRIS system during the pandemic just because of the demands that were in place in programs and, desire not to overburden programs. It does feel like it's a direction for us to start, revisiting in this coming year. One place that we continue to think about is revisiting from a supportive perspective. So how is it that we are in with programs and supporting them in starting strong? So thinking about what can we do when programs open up for the first time to start programs off on a strong footing. Thinking about with the staffing challenges, what is it that we can do to support programs that are hiring new staff who are coming in with a range of experience and qualifications to also, both build the program capacity internally to support quality and support their educators, but really do it from the perspective of working closely with new educators and thinking about, how do you get a new educator in a strong position within a program. We do have a framework, and we can talk about this at a future meeting. It is built around the idea that continuous quality improvement is sort of the heart at a program level of the type of work that we want programs to be doing. But it does feel like, to me, the challenge this year is really thinking about how are we in there with programs and what are the supports that we're providing.
I think even as a practical matter, and this was true across systems, but we froze a lot of things, or we turned off a lot of things by necessity. And I think this is what I was saying about the conversation yesterday with the governor and thinking about coming back and not turning back things on that didn't work. Mm-hmm. And so I think we as a board and we as an agency will have some decisions and thoughts to, some of the quality initiatives or requirements or teacher qualifications, which we changed, and do we want to turn them back on the way they were, or do we want to revisit and think about a different way? And I think, for better or worse, this has given us a little bit of that opportunity to think about what is that. If we're going to turn something back on, we should turn it back on in a way that makes sense for programs, that is implementable and has an impact for families.
Then your user lens is the right lens for all of those discussions, right? And the lens from the user to the quality for kids and families, right? Mm-hmm. Yeah.
If I could just add that there is a lot of interesting new innovation going on, I think, even now in some programs, and particularly with classroom learning for teachers, coaching, and I think, where we have such flexible money, not to use it only for new programming and helping new programs, but also maybe identify some of that learning that's going on and create pilots that then could be an example or model going forward, so we don't lose this opportunity, the extra money to do some really creative programming.
So maybe we'll wrap in a couple minutes, take a short break.
So I have one slide left in this section.
She's good at what she does all day.
Jocelyn, you're going to come to my research group.
Duly noted. So just looking at the information that we have on educators as well that's come in through the application process. We do have salary information. Again, I think in the interest of making this not too onerous for programs, we ask them to report on the highest and lowest salary by position. So by assistant, teacher, director, and for FCC's FCC assistant. We do also have this in the out-of-school time roles. It became a very crowded figure to put all those roles in, but I just note that the patterns we're seeing here are similar in the out-of-school time space, although the way the roles function are slightly different. Overall, when you look at just systemically, we do see that salaries seem to be trending upward, or at least the range of salaries. So this reflects sort of the average within program range of salaries. This is not the whole range of all salaries that are provided, but sort of on average, the lowest and highest within these programs. And they do trend up over time. When you look within programs and actually look at programs that change, it is important to recognize the distribution is a little skewed and that there are some programs that don't report changes at all. But there are many programs that do also report that the salaries have grown in small increments. So again, I think the field is responding to the challenge and using the resources that are available to respond to the challenge. We also do see systemically, and again, we only have data going back to the summer, that sort of staffing levels, the numbers of FTEs at least, seems to be somewhat constant. But I think it's also important to reflect that the workforce crisis that we've been facing predates the grant funding. So in some ways, this is probably just sort of maintaining. But programs, for example, in the fall, were reporting 69% reported they had educator opens. In my memory, it was about on average 3 per program. So, we're kind of hanging on here, but it isn't, I think there's work to be done and continued attention to be paid in this space. And so I think, yes, that's my last slide, except for discussion, which I think we've really largely had as I talked, which is great. Although if anybody has any last thoughts or reflections.
Just one other comment on the salary slide. It is salary as opposed to, you talked earlier about how some programs are providing other benefits, non-salaried benefits. So in theory, the picture may even look better than what is shown here if you were to monetize or quantify all
The
those
benefits that their total resources they might have received, yeah.
Although the average hourly earning for an assistant is still very, very low,
Yes.
even with the improvement. Workforce issue.
Thank you so much, Jocelyn. Your team has done a terrific job and given, all of us a lot to think about, but also a foundation on which to build where we go. So thank you so much for that, and to Adrian and Wendy also.
No question. Should we take a 10-minute break and then we'll spend a few minutes on the market rate survey? Thanks.
Thank you.
Dave, I do want to tell Dave.
Oh, Dave, sorry. And I just realized, Dave, we should have been telling you what slide number we were on. So we'll do that. So,
I'm following with good here.
okay, all right, terrific. So we're going to take a 10-minute break, and I think we'll leave you on because it was hard to get you here. But
So,
all right, thanks. But I'll mute it so you don't have to listen to the background.
Convene for our final agenda item of the open meeting on the market rate study. And we're going to turn it back to Jocelyn Baum.
Thank you, Chair. We all set?
Yes.
Okay.
Dave, are you there?
Yes, I am.
Okay, great. We're going to start on slide 22.
Thank you. So at this point in the meeting, I want to give an update on a sort of combination of market rate study and cost study that we plan to conduct, in part in a response to federal regulations that do require us to either conduct a market rate study or an alternative methodology to set subsidy rates. And this has to be done on a regular cycle. Due to COVID, we're a little bit behind, but we are going to use the market rate study to maintain compliance with that expectation. But also do want to supplement the market rate study with a cost study, because each one provides a different but yet important piece of information in thinking about rate setting. So I'll go through the details on each of these and the timelines, and there is a role for the board in this process. So we are required to conduct the market rate study, and you as a board will be, we will need your approval of the final analysis. So we'll continue to keep you updated as we go through this and look to bring information to you in September. One thing that we are excited about in the market rate is typically we conduct a survey to get the rate information from the field. One of the requirements of applying for the C3 stabilization funds was that programs did have to complete their hours of operation and the rate information on the child care search page. So there is a place where you can go to search up programs, and you can look locally and find like parents can look locally and find programs in their area, and then a page comes up for each program that includes information and details about the program, and that can include the rates and the hours of operation. And we've actually set up the application process so that you do need to have that information included. And this will allow us to get a sample that covers both programs that receive subsidies and programs that don't receive subsidy. And when we were conducting a survey, that was the one challenge that we faced, is really getting a good sample from the non-subsidized population of programs. And the expectation of how we use this information for rate settings from the federal expectations. This isn't an absolute requirement, but agencies are encouraged to set rates or aim to set rates around 75% of the market. And effectively what that means is you look at rates by region, by program type, and by age group, because that is how we set our rates. And within each of those subsets, you can look at all of the rates and the range of all the rates that are available in the field and identify, okay, what is the rate at which 75% of the different programs offering childcare in that sample would be covered by that rate. And then the idea being that if you set the subsidy at that level, parents that are coming into the childcare market with the subsidy would have access to 75% of the programs that are available, because their subsidy will cover the rates that the program is asking for. So it's not focused on the parent's own ability to pay. That is something that's managed through the parent fee process, which is separate and something we spend a lot of time on last year and can certainly refresh at some point in time. But that is not the focus of this work. And the goal would be then to inform our rate setting so that we are thinking about the purchasing power of families in the market. Any questions on that?
I'm so slow. Can you literally walk through that from take one example and a price, a rate, and so like one family.
So the subsidy rate is the same for every family with a subsidy.
Okay.
So any family coming that receives a subsidy, we have rates set by the different ages. And I'm not going to make up a number right now because I know I'll come up with something
Ages,
crazy.
type, and region, right? So the rates vary by ages, type, and region.
But this won't affect the family.
But every family has a subsidy for the same amount. The only difference for families is how much what component of that they have to pay as their parent fee, which is based on the family size and income. So that is something that we just recently updated and sort of set those benchmarks for the family in terms of how much they have to pay based on what's affordable for a family. This is really about sorry, go ahead.
Is your question more about applying the 75?
Tuition.
Oh, tuition.
Tuition.
Yeah, so the market rate, the subsidy is the outcome.
Yes.
Backing up, the idea is to capture the tuition rates across the state.
Yes.
So that families can have purchasing power with their subsidy.
So you do a survey of what ideally anyone might be charging, and then it's supposed to help inform our rate so that our families have access to at least 75% of the
Of
market,
what
right?
that
So say it's $100 for, wouldn't that be awesome? Say it's $100 to access an early education and care program. This would indicate you might want to set it at $75 so that you have access to 75% of the market. But we have used it variably over the years. It's not like we do the survey and then we're like, okay, everything gets at 75%, but it helps us understand what our rates are buying in the market on behalf of families and what that means in terms of their access to the different.
Just ask a question which I should know the answer to after all these years. Is it the 75th percentile of the market rate, or is it 75% of the market?
75th percentile.
Right.
Yeah, right, percentile, right.
Which gets to the set that theory allows you to access 75% of the market.
Right. Not 70%
Whereas
of the
75% of the
tuition.
market rate, it might be 0% of the market.
Yeah.
Right.
Right. Got it.
Sorry.
Okay, thank
Yeah.
you.
Yeah, that's better way to say it. Right.
And family versus group doesn't factor into this.
We'll collect data.
Oh, the program type does include that. That's not just infant, toddler.
Yeah. We do it
Ages.
by ages, program
Okay.
type, and by region.
Okay, sorry, I missed that.
Yeah, I think I slipped it in quietly. But the 75 percentile of the market is sort of a goal that the federal government sets, and we could look at what other states are, and we can when we bring back the full data, you'll see where our rates are compared to that, and they vary quite a bit. Again, by region and age, and where they fall is different across all of those different subcategories.
Right.
They're a component of how the rates get set, but there are a lot of other factors that influence what rates we're paying,
Including history.
and funding. Yeah.
So then the cost component is a supplement to this piece that allows us to understand what it costs a program to operate and provide the services that they are providing to families and children. And you can look at cost models by different program types again, but also you can start thinking about the cost of quality in some of these models and do some more nuanced work on sort of what we expect different types of services to cost. But what this does in rate setting is it allows us to look at the difference. The cost of programs does not necessarily drive rates. One would presume it's a factor in how programs set rates, but the market is so much of a stronger driver of those. Making sure that as we think about subsidy rate setting, we're also taking into account any differences between the ongoing rates and the costs that programs are assuming to operate. And it also will, provides us with critical information and thinking about other ways we might be supporting programs and financing their operational needs. So using the cost models to set the level of stabilization funding, for example, is one way, a different way that we used that cost information. We do have models from 2019, but we do plan to update those and further develop this work. So the timeline is we are in the process. There is actually a procurement out right now looking for a vendor to come in and conduct this work for us. It was posted on May 5th. I believe we are expecting to get responses on the 19th. So we are going to move quickly to contract. We hope for a robust response to that procurement and begin work on analyzing the current information that we have on the rates over the spring and through the summer. And in the summer, we also do plan to start collecting additional information to inform the cost models. Then in the fall, we will come back to you with an analysis and recommendations. And this is the federally required step whereby we need your approval. I think we will certainly plan updates before then, so this will not be the first time you're hearing from us on this, but that would be the moment to formally approve. And then through the fall, we could continue to work on the cost models, but also look at some of the factors that shape the costs that programs are bearing, as well as the way in which they set rates, to get a better understanding of the business models that programs are operating with, as well as the contextual factors that shape those. And then going into the winter, not only out of this process do we want recommendations around how to set rates, taking into account all of the pieces of information that we're thinking about. But also, also thinking about how this informs our thinking around the foundational grant funding that we could potentially provide, as well as looking into other opportunities, like are there efficiencies that we could gain through shared services and standardize some of these costs a little bit more for programs and manage them. And throughout all of this, there will be ongoing stakeholder engagements, including you, but also with other groups as well, both as expected from the federal expectations, but also because that's the way to do this work and to get good information from the field.
Questions on that? I mean, we're partly seeing it, this is to comply with the federal requirement, but to do it in a way that informs our thinking. So we've kind of expanded, what is minimally required in terms of the federal compliance so that we can gather information that can be supplemented with what we learned from the survey for C3 and other data.
Questions, comments? Okay, we'll stay tuned
on that
for next steps. Yes, lots of next steps today. It's great.
Yeah, right.
Sorry,
I was just going to say that concludes kind of the presentation from the EEC team.
Great, thank you so much, Commissioner. One comment I thought, just to circle back to the first item, I think one thing that's been running through my mind that I just wanted to share with fellow board members is there's sort of some meta level in these items today, which is to say your 2 strategic projects and the C3 is in part in service of those initiatives, but also in service of what do we learn for the systems building, and how do we work differently at the agency? And I just want to sort of lift that up because I think this is a really energizing meeting to kind of think about the work at multiple levels and its ripple effects for, we've talked for a long time about the agency continuing to evolve into this sort of service agency with an executive team that is innovating at the same time as meeting its mission on the health and safety. And I think I just wanted to kind of make that point. I think there's a lot here that suggests, yes, we'll do this work and we'll learn from it in service of the systems building. And I want to be sure we keep that in mind together. Okay, the board will now meet in executive session to discuss strategy related to pending litigation, the Echevarria matter. The board has determined that discussing this matter in open session will have a detrimental effect on the litigation position of the body. So the board will not reconvene in an open meeting following the conclusion of executive session, and instead we will adjourn directly from that executive session. So what I will do now is call the roll so that we will move into executive session, convene that way. And I will call the roll and then we will do that. So Sheila Balboni.
Yes.
Paul Belcido.
Yes.
Jamila Lee.
Yes.
Secretary Pizer.
Yes.
Maura Siegel.
Yes.
Nikki Ruiz de Luzuriaga. Joni Block.
Yes.
Yes.
David Cruz. Commissioner Kershaw, I suppose.
Yes.
Okay, so at this point, the open meeting is concluded, and I will excuse all members of the public, and then I will ask David to make a statement, and we will call Allison back, who would like to join for the executive session.
Christina, can you help us get